Good afternoon. My name is Eileen Nicoletti, and I'm one of the medical directors here at Rocket. I'm a pediatric hematologist, oncologist by training, and I've taken care of many children living with rare diseases. And I'm really honored to be here today as part of today's celebration. As Latika mentioned, I'll be providing a brief introduction to amyloidosis to provide some additional context for today's important discussion. Undoubtedly, though, the most valuable lessons that we'll learn today will be from our special guest, Altaf, who has been living with this illness for over 15 years. I first heard about amyloidosis as a second-year medical student during one of my pathology lectures, as my professor showed a number of histology slides and described the symptoms associated with this condition. He told us never to forget this disease. He then went on to describe how he, as just a third-year medical student, had correctly diagnosed a patient who had previously been seen by multiple providers at multiple institutions and undergone numerous invasive tests without receiving a proper diagnosis because no one had considered this rare disease. He reminded all of us of the importance of listening carefully to our patients, taking the time to fully understand their symptoms, and considering all potential diagnoses. His words made an indelible impression on me and that have continued to resonate with me now, 15 years later, and especially today as we honor all of those who are affected by a rare disease. If we could go to the next slide, please. Amyloidosis is an umbrella term that describes a group of rare diseases that results from abnormal production of amyloid protein. The amyloid can accumulate and be deposited in different organs, tissues, and nerves, and significantly affect function. There are many different types of amyloidosis, but today we're going to focus on primary or light chain amyloidosis, which is the most common form in developed countries, with approximately 4,500 cases diagnosed each year. In light chain amyloidosis, an immune cell in the bone marrow, known as a plasma cell, undergoes abnormal changes. The plasma cell then produces abnormal light chain proteins, resulting in amyloid deposits that can damage vital organs, particularly the heart, often resulting in heart failure. It is critical, as you can imagine, to make this diagnosis as early as possible to avoid further organ damage. However, diagnosis is unfortunately delayed, often because signs and symptoms mimic those of other more common illnesses. The illness typically affects people ages 50 to 80 and is more common in men. It can also be associated with a form of blood cancer known as multiple myeloma. As depicted on the slide, amyloidosis can impact all systems of the body, with the heart, kidneys, and nervous system being most affected. Patients can experience very debilitating symptoms, including shortness of breath, irregular heartbeat, leg swelling, dizziness, pain, and numbness, and also digestive issues. Treatment must be tailored individually, and it requires a multidisciplinary approach. It is imperative that patients receive treatment from experienced physicians. Supportive treatment for this condition is focused on minimizing symptoms, including those related to heart and kidney problems with medication. In advanced disease, patients may require heart or other organ transplantation. In addition to supportive treatment, source treatment with the goal of hopefully slowing down or stopping the amyloid production is also administered and may include a combination of treatments, including chemotherapy, targeted therapies, autologous stem cell transplant, or other investigational therapies. I want to thank you very much for your attention, and I'll turn it back to Latika for this afternoon's very important discussion. Thank you.
Thank you, Eileen. I feel like every time Eileen speaks, I learn something, every time, and I've known Eileen now for 4 years. The next session of the presentation today is really important for all of us to hear. And the reason is we're working on, either the AAV business or the LV business, and it's really important to understand the options that the patients who we are fighting for cures, what options they have today. So with many of our diseases on the AAV side, the standard of care could be a heart transplant. On the LV side, the standard of care could be a bone marrow transplant. We know patients who have had these, but we don't really know what it is like when we pull back the curtain. So I wanted to introduce a dear friend of mine who I've known now for almost 20 years. 15 plus of those years, he's had to fight a very long battle with his rare disease of amyloidosis and the subsequent results of his body, where he needed a heart transplant. He then, in between getting a bone marrow transplant another year later, he had to be treated with chemotherapy for his multiple myeloma. And he's going to show us in very real terms what it is like to live a life of all of these, these standards of care that the patients who we fight for are living with. So I wanted to, last night I met with Altaf. In fact, I've met with Altaf quite a bit recently. And we talked about his journey. Even though I've known Altaf for many years, and by the way, it is because of Altaf I left medical affairs and I joined commercial, and we launched many drugs together. And through that, one of the launches that we were working on, it was an HIV. It was the first single tablet regimen. It transformed patients' lives. But there was something wrong with Altaf. So if you look at the first bullet on this arrow, 2007, I wrote, "Something's not right." This is what many of our rare patients go through. They know something's not right. So Altaf went to countless physicians, and they said, "Gotta lose weight. Altaf, you probably just have high blood pressure. Altaf, you're working way too many hours." Something we heard Becky say a little bit earlier. But he kept on working, and we worked really long hours in those days. And he was misdiagnosed with many, many different diseases that he's going to talk about. Then all of a sudden, in May of 2008, he was in a meeting. He started to look pale. He was clammy. He had shortness of breath. And he didn't want to leave this meeting because he was also working on another launch. And it was actually my husband who was in the meeting with him who stopped the meeting and said, "Altaf, you're coming with me." And he drove him to the ER. And we'll talk about why that was a very significant point in time. Because when he went to the ER that day, imagine going to the ER, you're not feeling well, but you stay inside that hospital for a month and a half, a whole month and a half. And during that time, they still couldn't figure out what was wrong with him. And they discharged him. He went home for one night. He collapsed. He had a concussion. His mom happened to be there, called the ambulance, and he went to another hospital from Princeton to UPenn in Philadelphia. And there, they couldn't find out what was wrong with him. And I'm not going to give away how he was diagnosed, but it's a really interesting story that we should all keep in mind about rare patients. So they kept him in the hospital, and he was there for 6 months at Penn. And during that time, after the diagnosis, which I'll let Altaf go through, the physicians basically said, "Okay, Altaf, we can't help you anymore. We're going to refer you to hospice." And he's going to talk about how he, first of all, didn't give up on himself, and two, he had a really important network of people around him, and that network in rare patients is really critical, because that person who didn't give up on Altaf either was his brother, who happens to be a cardiologist. And he looked to transferring Altaf to different hospitals. 3 different major institutions in the US rejected him. They said, Altaf, we can't treat you. And finally, UCLA took Altaf. And so a medical flight was then arranged. Altaf flew over, and he spent another year plus in the hospital. And it was there that he was finally diagnosed with multiple myeloma. But before any treatment could be done for multiple myeloma, he had to get a new heart. So he got a heart transplant. And then they had to watch him because, after heart transplantation, you're put on immunotherapy. You're basically immunocompromised, sorry. And so he needed his immune system to be strong enough to be able to receive chemotherapy. And so he was treated for multiple myeloma. After that, he was then discharged, and he's going to talk about what happened after that discharge, because you get a new heart, you get chemotherapy, you go home. What's life really like? And so he's going to talk about what those 6 months were like before he was readmitted for another year. And during this hospitalization, he received a bone marrow transplant. And so Altaf lives each and every day with a sense of gratitude for each day, a new beginning. I feel, I've known Altaf for a long time, so I'm going to say this, but I feel like the new heart has made him warm and fuzzy. So he's going to talk about what this journey is really like for our rare patients that we work with every day. And as Altaf walks onto stage, we're going to play a song that is of significance to him. So Altaf, come and join me.
I will survive. Oh, as long as I know how to love,
I will survive.
We all will, right?
Yeah. Altaf, you were, many people in the audience can probably relate to what your life was like before you started to get really sick. You were working really long hours. You were a rising star at a large pharmaceutical company. Can you just describe what life was like before all of this went down?
Yeah, so I didn't get the memo. I thought we were going to talk about the go-to-market strategy for rare disease.
That's with Carlos.
Did I miss it? No, on a serious note, before that, I do want to thank Dr. Eileen, the presentation this morning. As much as, and you know me very well, I tend not to look in the past. The voice of Eileen, Dr. Eileen, the empathy in your voice did leave an indelible mark with me. So I know someone left an indelible mark with you, but you in turn did that to me, despite what I thought about myself, that I really don't look in the past, and I did, which surprised me in itself. So thank you for that. But to your question, in terms of pre-diagnosis, I'll say a one-liner and then go into our time when we were together when we launched Tripla. But I think I had a very normal life in terms of family, friends, skewed a little bit more on the work side by choice. Loved it, but I was healthy in that I had never taken a Tylenol in my life. And I mean that literally, not figuratively. I'd never taken a Tylenol in my life, and I'd never gotten a headache in my life, and the idea of taking something, despite being in the pharmaceutical industry, would be unheard of for me. So in that respect, I was super healthy. But the beginnings of it was during the time when we were working on an HIV product. I began to notice something not quite normal. In hindsight, I should have been a little bit more held myself to account to my own health. However, at that moment, I think many times it's just human nature to chalk it up to something. I'm working too hard, thus I'm tired. I have to deliver something by choice. Nothing is forced. It was by choice. Therefore, I will postpone going to the doctor tomorrow. But shortness of breath was beginning to set in. Or if I would go to the gym, historically, if I could run comfortably for 3 miles, it was down to 1.5. Or I couldn't walk a flight of stairs, and I always had some excuse as to there's something not right, but frankly, I didn't take it to heart. This too will be a phase. I thought this too is a phase. And there's evidence, no, the picture's not there, but there's evidence I did put on a glorious amount of weight too. And I was like, I gotta lose weight and everything will be fine and dandy. So I think that's kind of how I rationalized it more than anything else. And that was the beginnings of what I realized is not quite right.
Yes. Actually, could we go to the next slide, please? Altaf was not overweight by any means, but if you look at the top left picture, Altaf all the way on the right side, that's what he looked like back in 2006, and haven't changed that much, Altaf, other than a new heart and bone marrow. And Altaf, can you talk us through the diagnosis journey? Because earlier Kinnari talked about how long it takes for rare disease patients on average to get diagnosed. It takes 5 up to 7 years sometimes, and they go through heck. So what happened to you, and how did you finally get the diagnosis made?
Yeah, so when Kinnari was talking this morning and sharing some facts, that did hit home on a very personal level. Because as I reflect back, the diagnosis, even after I realized, okay, I need help, it took forever. But let me walk you through a little bit of the journey as to what was the beginning of the discovery. And I was actually traveling in East Africa with my brother. He was doing some volunteer work there, and I decided to just go and spend some time with him there. And I was not right. I couldn't climb a flight of stairs. And my support system, or my brother in that case, he happened to be a cardiologist, which worked to my advantage. And a quick examination, and he goes, this is not right. This is not normal. I don't care whether you're overweight or you're underweight, this is not normal. You have tachycardia, you have AFib going on, immediate diagnosis without having the right tools. And being in East Africa, he recommended I take the next flight out. So that's what I did. I took the next flight out and began my heavy journey into understanding what's going on via physicians. But that was a laborious process. It was a very lengthy process to get it diagnosed. So it started with going to my primary care doctor, going to see a cardiologist, and I was diagnosed for all the right reasons, but these were the side effects. It's the cause and effect. So I was diagnosed with AFib. Great. Get an ablation. Go on Coumadin. Great. Tachycardia. Another medication. Leg swelling. Go on this inhibitor. Take this inhibitor. Take ACE inhibitors. So it went on and on and on. But the diagnosis was very, very unclear. So this took a period of time. The stretch was quite lengthy, not quite pinpointing what's going on, other than the fact there's something going on with the heart. I wasn't quite in heart failure or cardiomyopathy at that point, but it wasn't quite right. The EF factor was gradually declining. Your EGFR, your creatinine levels begin to rise, but to no account. So there wasn't a clarity on what's the root cause of what's going on. So that began a deeper journey into understanding and getting to a diagnosis, but it still wasn't there. So that itself was a very long process. It just happened one day, a deeper journey happened when I was at work, working on Abilify with Ben Hickey, your husband, and we were working together, readying a big launch with all the exciting, all the drama, all the passion, all the arguments. And this was around 8 in the morning or 7:30 in the morning. And I just could not get out. I remember sitting in that meeting, my computer bag was too heavy for me. So it wasn't that I was collapsed, but I wasn't right. To a degree, I wasn't saying anything, but Ben said, there's something wrong with you. This is just not right. Right now, we're going to the hospital. And so I remember that so vividly because I denied going to the hospital. And he used some 4-letter words, some choiceful 4-letter words, saying, now, I don't give a ... And I would make every excuse. My car is here. I know how to drive your car. And so he just took me to the hospital, and that began a deeper journey in the process of diagnosis. But I was admitted to the Princeton Hospital for a period of time. They couldn't quite figure it out. I was there for a month and a half, went home. As Latika, you mentioned earlier, I'd collapsed at home. My mom happened to be visiting me from California. I was in Princeton at that time. She called 911, and I was rushed to UPenn. So that began a deeper journey into understanding what's the root cause. But even up to now, and this was now, the length of time had progressed, the root cause was unclear. The root cause was still unclear.
And very frustrating.
And at that point, yes, it was frustrating to me. And I think this, yes, it was very frustrating. A sense of anxiety also comes into play. The unknown, at least, and each person is individual, to be clear, right? It's n equals 1. But for me, the unknown, it's better to know what it is, and I don't care what it is, but the known is a lot more actionable than the unknown. And I think that's part of being human as well. But I do think the hardship was just not to me, but it was to the support system, to my family. I will add that to you because when my mom was visiting me, you used to schlep my mother from Princeton to UPenn to come and visit me, because she was not driving. So there's a big burden on the support system, on the caregivers, and the anxiety to immediate family was even more so because they do carry the burden of the stress as well. So that continued on. And then the diagnosis at Penn was ironically made by an intern. An intern, out of the blue, said, we got to test for amyloidosis. And so they did go in the heart and do a biopsy, and sure enough, it was amyloidosis. But it was discovered by an intern. And so, again, this just highlights the importance of a holistic care as well as actually, I also hold myself to account to a certain degree, given I work in the pharmaceutical industry, and for all real purposes, we come from a reasonably educated class versus my mother. So in some sense, my proactive role should have been there a lot more. And that's, not here, not there, but in hindsight, the role that I could have played would have been a lot more proactive.
And I think you evolved because self-advocacy is very important in rare disease. Many, physicians, when they see patients, don't have a lot of time to spend with them, especially if there's not a diagnosis that's yet made, and genetic testing is not yet offered. So you advocated for yourself quite a bit later on, and I think that really helped you through some of those transplants and treatments that you had to go through.
Yes.
The heart transplant thing is important because recently I've been on the phone with many Danon female patients. Danon disease is a disease, a genetic disorder that affects the heart also. And in females, they don't have that, there's not an urgency like the male population to get a heart transplant right away. So they often contemplate when it is that they should even consider a heart transplant or how long they should prolong it. Can you talk through how you emotionally prepared for such a procedure and what decisions you had to make?
So I go a little bit of a step back. When I was at Penn, after they made the diagnosis, and then it was clear it's amyloidosis, there was a root cause that had already progressed to multiple myeloma, and I'm not sure of the relationship, but either way, it's a sister disease, and the organ that was affected was the heart. So that was very clear, but I wasn't getting treated. They refused to treat me, and we know the numbers game. It is what it is. No hospital wants to have a decrease in the numbers. I understand that. But I went to UCLA, and for a reason. My brother, my sister-in-law were both happened to be practicing physicians, and so the network and the influence, for honesty, helped me get treatment at UCLA. For me, I was in a unique position to have an extraordinary support system. An extraordinary support system, certainly with an extended network in Princeton. You, Ben, Lori, I could bring so many other names in. But I come from a very tight-knit family as well. So my sister-in-law, my brother, my sister, they were actually schlepping from LA to Penn, and they were taking turns every week. So just to make sure, regardless of day or night, I had support system 24/7. So for me, the way I dealt with it, I was actually, I'll use the word somewhat selfish and let them worry about it. I banked on trust. And interestingly enough, I was reading on your website, and one of your core values is trust. That hit home very well to me, because that's really what I did. I left it to trust. I didn't want to read it. I read. I'm not saying I didn't. I'm going to lie and say if I left it completely. Yes, I read about it, but I chose not to spend a lot of energies in that. I'm not an expert. I was in no shape. My legs were swollen, my heart was swollen. I was sitting in the hospital bed. I didn't have the energy or the drive to worry about it. So I was fortunate enough to let the burden sit with my support system, frankly. So I let them make the decisions, call the hospitals. I was getting denied. I said, keep me informed. I need to know because. I just need to know. So they kept me informed. Penn declined. Mayo declined. UCLA, check. We're on our way so I dealt in part with that. I think what I learned in that transition as well, from, I'll use the word pre-diagnosis in a loose kind of a way, to as I was going through that journey, I think I learned, while I'm still passionate about life, I'm still passionate about driving the business. I am. That doesn't change at my core. But I learned to live in that moment. And I think the transition from Penn to UCLA, my dependence of others, because that to me was the hardest thing. It wasn't about life or death for me. I was fine. It is what it is, no big deal. But the word being dependent on someone was the most frightening to me. Less about life, or that was not the bother. Or if I had to be in bed, that didn't bother me, but the dependency, but I learned to live literally in that moment because I couldn't rewrite the past. So I started to move into the mode of thinking my life as a book. I don't want to look at the past. I can't rewrite. I know what the past is. I know the chapter. I don't know the future. Let me struggle in the moment. Let everyone else worry about what I need to do. But I was in that unique position, in all honesty, to let others help me through that journey.
Yeah. It's really interesting. People are often afraid to ask for help, but when you do, people stop everything and help you. And I think your support system definitely did that. And it also, I think it changed your mindset a little bit.
You know, I think it did. And there are some moments, and I'm going to go completely off your script here, but you say support system, sorry, you knew I would do that. When we talk about a support system, you know, there are moments that matter, that you cannot forget. So my brother coming back and forth, my sister coming back and forth on a weekly basis. And there's an unwritten expectations between us siblings, and unwritten expectations. But there are moments, I do remember actually calling you up once in the hospital when I was, and I was so sick and tired of the food, it was like 2 p.m. And I actually called you up, and I said, I can't eat this food anymore. And you said, what do you want to eat? And I said, samosas. And you were there at 6 p.m. And so this is what I mean by there are big moments in helping you, but those moments really get through the day.
It's the small things people can do that
Yes.
can make a big difference. Altaf, there are a few pictures on the slide that everybody's looking at. Can you take us through what your day-to-day life is like, and especially that big picture in the middle?
Yeah, so, you know, I still believe I try hard in trying to live for today. That doesn't mean I'm not a planner. That doesn't mean I don't think about the word contingency. But I try not to worry about things that are not actionable. And that's why, actually, when Eileen was talking, it did take me back, despite what I would like to do, because it's not actionable for me. However, what is actionable from my past is being very vigilant about A, what is wrong with me, or taking care of my appointments. I don't miss that. I don't miss that with all my heart and soul. I am very cautious about my lab values. I understand that, but I know that's actionable if I take care of it immediately. So I think that's one element that has changed dramatically in terms of how I lead my life. The second element in terms of focus is, you know, I am thankful. I am grateful. I'm thankful to the support system. I'm actually thankful to the donor heart, and I try not to think about it because it is awkward. On the one hand, someone had to actually die for me to survive. Yeah. So why am I the lucky one? Why someone else isn't? You know, I from moment to moment, I will think about it, but I try to parking lot it because it's not actionable for me other than being grateful. So I think those are the good things about how I live my life. But there are adjustments. But that's no different than most people, right? You have kids, you have to adjust. Your kids go to college, you have to adjust. So in that respect, I think of it as it's ebbs and flows, and you got to adjust. You just adjust smartly. So one area is what's in the center of the screen is the number of pills you take. So yes, it is a burden because I don't leave home without it. So when one thinks about travel, the first thing I think about is my pill box. Do I have my Band-Aid? Oh, thank you for that free gift from Band-Aid. My Band-Aid.
Thank you, Ann Standard.
And I think about, my thermometer. Then I think about everything else. So your pattern changes once you undergo such an event. And the meds are, of course, it's a chore because you do have to take, this is what I do take every morning. There are about 15 because there are lots of side effects, right? Coming out of it, be it, it's not just the immunosuppressants, but then you end up with high cholesterol. Well, then you end up with high blood pressure. And I still tend to believe I'm a consumer versus a patient. But you got to make those adjustments.
You control the controllables.
Absolutely. So I hold myself to account to what I'm controllable. I can control if I take my meds or not take my meds. That's in my control. But it's not in my control as to what happened and what should I do. So I'm more vigilant about what I can hold myself to account versus where I cannot hold myself to account. And I'm still very, very dependent on my support system to get me through things.
Yeah, yeah. So that bunch of pills is what Altaf takes every single day, and he'll have to do it for the rest of his life. Altaf, in rare diseases, the concept of impermanence is really something that I hear about from many patient communities. They don't use the word, but the concept of it, because of the unpredictable nature of their diseases, they don't know what will be lost. Either a life or a friendship or a job, or there's so many things that our rare patients go through. Can you talk us through how you get through your concept of losing things?
Yeah. So what's the word you used again? Can you say that?
Impermanence.
Impermanence. So first, again, I will highlight this as n equals 1, right? It's sample size of 1. But I can speak from my perspective. So I do believe, and I really do believe, that everyone in some way, in some respect or the other, has a sense of impermanence. In the truest sense, I don't know, and actually you don't know either, if you get out of here, in this room, and will one of those kids have COVID? I don't know. You don't know. So the sense of impermanence to me is nothing more than part of day-to-day living. And that's okay. So I don't see this as anything above and beyond. So the way I deal with impermanence is I'm okay with the unknown, but I'm not okay if now that I know something and I'm not vigilant about it, then I have to hold myself to account. So I think that's really how I deal with the sense. That works for me.
Yeah.
That works for me is living for today. It's living for today and doing exactly as I'm planning for in the next, I plan to do X, Y, and Z tomorrow, the day after, but it may or may not come to fruition.
Yeah.
Doesn't matter. I'm trying to do what I'm supposed to do, what I'm planning to do.
I think that's a reminder for us all to live in the present moment, and I know David Nichtern's going to be talking a little bit about that next. Altaf, let's end with, what do you hope for? What do you wish for?
So I'll tie it back to the broader umbrella of healthcare and innovation. So the science, the innovation, the new technology, and gene therapy, not because I'm just sitting here, but that does bring hope to all of us, right? And so even let's just take gene therapy. There is a strong hope that it will replace immunosuppressants. What does that mean? A very different lifestyle, a very different lifestyle. So I do believe in hope. Despondency is for all practical purposes a sin to me. But what gives me that hope is innovation, is that science, is new technology, is actually, and I'm not just saying it, but I really do mean that, it's that curiosity and that passion that the scientists bring to the table, right? Because ultimately, that does elevate all of us. So I will go back to your core values because that did hit home to me, it did hit home to me to the core. but it's elevating, it's a curiosity that the scientists bring to the table. It's actually even what the commercial folks bring in curiosity in shaping the science for the patient. And I think that is what holds all of us together in terms of taking care of some of the rare diseases, that the diagnosis to progression is a lengthy process. And yes, we do lead a normal life. I do lead a normal life. And then there's the if or the but.
Yeah, I think that's a wonderful way to end. And a lot of the people who are sitting in this room are the brilliant scientists who are working on the gene therapy here. And so really kudos to the team here for all the hard work and the number of hours. It's not unnoticed that goes into it.
It doesn't go unnoticed, and I think once you're a patient, it has a different perspective. I was in the pharmaceutical industry, and I still am, but once I turned into a patient, it did change the mindset of the power of new science. It has a very different meaning than it had for me when I was, pre-diagnosis.
It's beautiful. Thank you so much, Altaf, for
you.
coming all the way from California
Thank
and
you.
sharing your story.
Thank you.